Hello everyone. Today I want to talk to you about the importance of COVID vaccination. Last year, when we had the first wave of the COVID-19 pandemic, everyone was praying, when will we get the vaccination? Today we have the vaccination, and of course several million people have already taken it, but there is some kind of a fear, a kind of hesitation among people whether they should take it. In fact, there are many people who are going on social media and campaigning against the vaccination. Let me tell you that the vaccination is the only support that we can have today to prevent a serious turn of events if you get COVID-19, or to prevent hospitalization, or to prevent deaths. We have already given the vaccination to several thousand people. We have not seen any side effects so far, touch wood, although admittedly, yes, one in several lakh people, maybe one in a million people may have a side effect. And even those side effects are actually treatable. As we know, we have two vaccines currently in India, the Covaxin and the Covishield. And again, people ask me which is better, which should I choose from? There's nothing to choose between the two. There are two different methods of production. One uses an adenovirus vector, the other is an attenuated vaccine. The Covaxin is an attenuated vaccine, whereas the Covishield or the AstraZeneca virus made by Serum Institute uses an adenovirus vector. Now, both of them are almost equally effective, and both of them are reasonably safe and therefore should be taken. Now, I have seen in my own experience within a family somebody who has taken the vaccine and others who have not taken the vaccine both get COVID-19. Now, the people who did not get the vaccination because they were not eligible at that time developed severe infection. Their CT scan showed extensive changes. Their blood tests showed very severe COVID. They had to be treated with steroids. Some of them had to be hospitalized, and some of them even became serious. On the other hand, all those who had been vaccinated hardly knew that they had it. You may say, then how did they detect it? Because everybody was tested in the family, they also tested. Incidentally, they were found to have the COVID-19 infection. The RT-PCR showed that they had it. But when they took the CT scan, clear. When they did the blood test, normal. They didn't need any treatment. They simply stayed at home and quarantined themselves. So that is the magic of the vaccination. So if there is one priority in India today, as we grapple with the second wave, it is that all of us who are eligible for the vaccination should go ahead and have it as soon as possible. Now, people with diabetes ask me, should I take the vaccination? If you don't take the vaccination, who's going to take the vaccination? We all knew from the first wave of the pandemic that it's people with comorbidities like diabetes, hypertension, heart disease, asthma, respiratory disease. These are the people who did badly. So you are the ones who need the vaccination most, and you are the ones who should be given the vaccination on a priority basis. There was a foolish statement made in the press some time ago when the vaccination was first introduced, saying that those who are on taking blood thinning medicines, that is anti-clotting medicine, should stop it. Now we know that it's the opposite which should be done. Nobody should stop their anticoagulants, or if you're on aspirin or clopidogrel, you should not stop it, because a rare side effect which is described is clotting. So why would you go and stop your anti-clotting medicine? Similarly, people ask me, should I stop my anti-diabetic medicines before going for the vaccination? Don't do anything. Just go ahead and take it. People say, should I get my diabetes under control before I go for the vaccination? This is not a surgery. If at all you're uncontrolled, you are more at risk, and therefore you're the one who should go and get the vaccination done first. So everybody should get the vaccination. If you have diabetes, particularly, you should have the vaccination done. At all our centers, we are trying to get the vaccination. Right now, we are doing it at our Gopalapuram branch. But it doesn't matter where you get the vaccination done, but I would implore you to go and get the vaccination done as soon as possible. Don't get afraid of the things that you read in the press and media. They are often exaggerated and blown out of proportion, and even a small thing gets completely blown out of proportion in order to make it sensationalism. in order that the press gets all the attention, sometimes these things are done. That is not to say that a very rare case of a side effect may come. That can come with anything. Even if you don't take the vaccine, you can still get, there is clotting which occurs by itself. And also with other vaccines also it has happened, with mumps vaccine, with measles vaccine, Japanese encephalitis vaccine, with the influenza vaccine, pneumococcal vaccine. With all of these, occasionally you get, haven't you heard of penicillin allergy in the olden days? Penicillin is a wonderful drug, it saved millions of lives, but occasionally you get a anaphylactic reaction or a shock-like reaction with penicillin. For that you cannot ban penicillin, suppose you find one cockroach in a biryani somewhere, you cannot ban all the biryani. You should find out why the cockroach came there and try to make the thing more hygienic so that you don't get the cockroach. That is the way you have to look at it. And therefore, my final advice to you would be, don't wait any longer. Go and have your first shot as well as second shot. In the case of Covaxin, the interval between the first and the second dose is 4 weeks. In the case of Covishield, a little longer is preferred. If you can wait for 6 to 8 weeks and the vaccine is available in plenty, then you wait a little bit more, because antibody production takes a little bit more time with the Covishield, and therefore you can even take it after 6 weeks or 8 weeks or even a little beyond that if possible. If nothing else is possible and you have to take it at the 4th week even for Covishield, so be it. If that's what you have been asked to do, go ahead and do that, but please make sure that you take your second dose as well. So I wish you all the very best. I hope all of you stay safe. Most importantly, those with diabetes, please make sure that you get your checkup done either through telemedicine or in whichever way you want, but you get your test done, do your home glucose monitoring, see that your sugars are kept under good control, and after some interval between the COVID vaccination, say maybe after a month or 2, you can also have your pneumococcal vaccination, which if you take it just once in a lifetime, or your influenza vaccination, which is also due every year, as you know. So those also if you take, then you're totally protected. So my very best wishes to you. Thank you.